Welcome back to the Now Morning Show. Our conversation continues with things that you can add to your Christmas calendar. And now we're talking about a Christmas Wellness Village Festival. And joining us is none other than Davlin Thomas, CEO of the North Central Regional Health Authority. Good morning, Davlin, and welcome.
Hi, morning.
How are you doing
How are
today?
you?
Good. How are you?
Yeah, great.
Now,
Thank you.
it's a pleasure to have you on with us. So from what we're seeing here, the Christmas Wellness Village Festival took place on the 14th of December from 8 a.m.
Yes,
to
sir.
2 p.m. Can you just give us a little insight into what took place and what it was like getting everything together?
All right. Well, basically, what we've discovered, this is part of some other kinds of preventative medical initiatives that we have in. So we usually have what we call the Great Pap Smear Initiative, where we see at least 1,200 women and do Pap smears in one day. We have the Men's Wellness Initiative, where we engage possibly about the same amount of persons in one day, and basically do PSAs and digital rectal examinations and so on. So and all in an effort to ensure that what we do is we engage the possibility of catching diseases up front, so that it does not deteriorate and the person becomes hospitalized and has to do expensive treatment. And just I heard on the other program someone say about downtime of machines. In the public health sector, we're at 99% uptime, just to mention, just to throw that in. However, those 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 services, what we do to encourage people to come is to have entertainment, etc. So it's really a fun event for our patients, our clients within our region. That has been very successful. So what we've done for this one is that we've created one that would facilitate with the entire family. And so basically, children pair with the parents. We've created a scenario where we have parang and then bouncy castles and so on, so that you could bring your child, do the medicals, and simultaneously have a fun day at the hospital. So, and we had almost 600 persons come in. And so that was phenomenal for us. We even had HIV testing, people, blood donations. And the numbers were about 600. We had at least 20 or so blood donations during the day. We had a number of HIV testing and full medicals for at least 537 people. That's fundamental to the thing. The real issue, though, is the gains that we get from that is that we catch those diseases way up front if they are there. And then the other thing is that people have the assurances that you're healthy if you are, and that you could engage in your Christmas. The Minister of Health keeps engaging the notion that, watch your numbers for Christmas, particularly those diabetics and hypertensive persons. And, this is really providing the support for that. But essentially, that's what we at NCRHA call our second concentric circle. Our first concentric circle is at the hospitals, the care that we provide there. Just outside that circle is where we do our preventatives to make sure to buffer the hospitals, to make sure you are healthy out there. And then there's another circle where we keep you healthy, where we have what we call our wellness club. Our wellness club has 4,000 members so far, and they're doing Tai Chi, aerobics, they're doing kickboxing, and that is and yoga. That has been phenomenal for us. So it's really a way of ensuring that people either stay healthy, or that if you do have a disease, we catch it at an early stage, and that then we're simultaneously working on the effectiveness and efficiencies within the hospital situations.
It's good to see, of course, that things are being treated with critically when it comes to preventative measures, even going to treatment and post as well, which of course is essential to our population being able to continue to thrive. Just going back to to the Christmas Wellness Village for a second. I noticed you mentioned so many different facets that were available, from testing to entertainment for the children and for the adults as well. When this idea was put into, well, I guess existence, or creation rather, was it done based on what you would have seen as what was previously more accepted by those who are treated by or part and parcel to the Women's Hospital?
Well, we had two agendas. One of the agendas was that we realized because we've tweaked over and over our men's wellness and our women's pap smear. And we realized the kind of entertainment that is required. We realized the kind of environment that is required to encourage people to show up for these preventative medicals. Remember, you really have people at their houses, and you really need to get them out of their houses. So some people come for the entertainment, some people come for the fun day, but while you're there, we make sure that you do your testing, and that you either contribute blood so there's some form of community. One of the things that the NCRHA is keen on doing is breaking down those walls between the community and the quote unquote system that we operate within. So that so that there's one system which includes both the patients, potential patients, and the persons who we keep healthy. And there's a kind of feedback loop between all three. And that is to say that we will engage you in exercise, etc., and so on at the Heart, and then we'll spread soon to other savannas to keep you healthy so that you don't have to engage in stay at the hospital, because nobody likes to stay at the hospital. As comfortable as it may be, where you have a lot of people calling a Rima General Hospital the Hyatt, but there's nobody really loves to stay at the hospital. Nobody likes to have to visit family at the hospital. So the real issue for us is, how do we keep you healthy enough to stay? What are the lifestyle changes that we need to encourage to facilitate that? And so one of the things that we've done is by creating an atmosphere for children in particular to show up at these wellness festivals. It's really the key to the future. So of those 500, we've had 250 children. 600, we have had about 250 to 300 children. Those children are not going to be fearful of a hospital environment in the future. They are basically seeing it as an integrated part of their own wellness, and that is the key for us. They've had fun at the hospital. They have no problems coming in to do preventative medicals. They've done it when they were small, and so sometime in 2030, 2040, when they become adults, they are going to see the hospitals as places where it's part of their own wellness cycle. So that's one of the key issues for us, so that to encourage parents to bring them, create the environment that encourages them to come. And once they get there, we engage them in testing and so on, talking to a doctor, getting feedback from. We also had dentistry, so getting feedback from a dentist, understanding that the hospital is there for you. It's not this medicine wall where people have to go only when they're sick, but certainly it's a place where you could go to keep healthy.
Definitely, and it's positive to see, of course, that the cycle is something that can be changed and will be changed with the future generations to come as well. Mr. Thomas, before we close our conversation this morning, do you have any Christmas messages you would like to share with Trinidad and Tobago?
Oh yeah, I would like to reiterate some of what the Minister of Health, the Honorable Terence Yalting, has been saying. It's really, if Christmas is a festive season, by all means enjoy it. Have a ball. It is the precursor to the carnival, but do everything in moderation. Ensure that you stay healthy. Get your exercise, drink your water, eat your vegetables.
Very important.
Have a merry, merry Christmas.
Thank you so much for joining us this morning, Mr. Thomas. It is an absolute pleasure, and have a wonderful Christmas as well.
Thank you very much.
Davlin
Merry Christmas
Thomas.
to you.
Davlin Toffers, CEO of the North Central Regional Health Authority, with us this morning, speaking not just about the Christmas Wellness Village Festival, but the ongoing initiatives in the region. Stay tuned. The Now Morning Show has more to share with you after this break.